Welcome to the CONNECT Collaborator interview series, where we host 10-minute conversations with healthcare professionals and partners with the goal of engaging deeper collaboration in the healthcare industry. Today's guest, Dr. Famida Jiwa, is the President and CEO of Osteoporosis Canada and has been with the organization since 2006. In 2020, Dr. Jiwa was elected to the Board of Directors of the International Osteoporosis Foundation, representing North America, for a term of 4 years. She also serves as the chair of the Patient Society Subcommittee of the Committee of National Societies of the International Osteoporosis Foundation. Famida, welcome, and thanks for being here today.
Thank you for having me.
Let's get started. Why are stakeholder collaborations in healthcare providers and industry so important for patients?
So if you think about patient care, a patient has interaction with their healthcare provider, has interaction with their pharmacist, has an interaction perhaps with an allied health provider, has an interaction with other individuals who have input into their care. So it's almost like the hub and spoke model, where the patient is at the center and all of the other services they access are around them. So as a provider, whether you are a healthcare provider or similar to Osteoporosis Canada, if you are a health charity, it's really important to gain an understanding about the different perspectives that the patient interacts with. And I think that gaining that understanding and securing a collaboration across those networks is really key to then more fulsomely supporting a patient. So, for example, you don't know what you don't know, right? So as a health charity, we think we know what we need to provide for people living with osteoporosis, but it's really the patient voice that is the critical part of informing our work and informing how we work. Having said that, resources differ across sectors. So the health charity sector may be very strong in certain areas in terms of program delivery, whereas other stakeholders may be stronger in other areas. So the one that comes to mind most clearly is a marketing and communication outreach. So healthcare charities, while we have that component, it may not be as robust as other sectors. So a collaboration across sectors, any stakeholder, whether it be industry, telecommunications, allied health, it's critical to gain the expertise from different sectors so that you can, in the most efficient and highest performing way, support the patient. They say it takes a village to raise a child. Well, it takes a village to support, in our case, Canadians living with osteoporosis. And we don't expect ourselves to do it alone, and nor should a patient, I don't think. I think there's really key in collaborating across sectors, and that's really where the wealth of information and the most appropriate support comes from.
Agreed. And so we're interested in the Canadian Osteoporosis Patient Network. Can you share really how you're working to share knowledge and resources relevant to patients?
So the Canadian Osteoporosis Patient Network is the patient arm of Osteoporosis Canada. So it has been with the organization since inception, and it is comprised of people living with osteoporosis primarily. It supports people living with osteoporosis, and it supports families and caregivers who are supporting people living with osteoporosis. And I would say over the past decade in particular, I've seen a tremendous increase in membership to COPN. And so COPN is the short form of the Canadian Osteoporosis Patient Network. I've seen an increase in engagement across this network. So it's essentially patients supporting patients. However, I think one of the biggest things that I'm the most proud of at Osteoporosis Canada is that we have really made germane to our function patient input in all aspects of what we do. So just last October, so October 2023, we released our clinical practice guidelines. And a patient has sat on each of our committees in the development of those guidelines. A patient is also sitting on each of our committees in the translation of those guidelines. So how do we take that scientific manuscript and translate it into real world information for people living with osteoporosis? We would never do something like that without COPN as our partner, because going back to my previous comment, it's really the patient who understands what they need and what's lacking and how to communicate and which way and how often to send messages out. The other piece that I just want to highlight, because I'm very proud of that as well, is when we were developing our clinical practice guidelines, we actually sought patient input before the entire process even began. So we had an open call to patients living with osteoporosis who spoke to us about what the gaps are, whether it be in the diagnosis, treatment, management of their disease. And we really tailored the manuscript around those gaps, and we ensured that we had patient input upon each piece. So I could go on for a long time about this because I'm passionate about it, but patient input is critical, and they're really an integral part of the organization.
Can you think of an example of a way that you've been able to empower patients directly?
As an organization, yes, for sure. I mean, echoing back to my previous comment, having patients involved in the functioning of an organization, there are two benefits, right? The organization has a benefit in terms of actually tailoring our material to where the information is needed. But then patients have a benefit as well because they are able to canvass the voice of their network and bring it forward and ensure that those needs are met. We also ensure constant communication between the organization and our patient network. During my time at Osteoporosis Canada, I've really seen the nature of input of our patients grow. And I think that also lends an opportunity for empowerment as well, because our patients are telling us how we should do what we do. They are also involved right now in our strategic planning process. So it's critical. It's important, if you're going to have patient voice, to actually utilize the patient voice and have almost a two-way communication. And engagement is one thing, but valuable, tangible, cogent engagement is a completely different thing. And I think as an organization, we've really been able to bridge that gap. And the increase in our network and the increase in uptake really reflect the value of that.
That's excellent. And so that leads us to the question of, what do you think is the future of healthcare?
So as an organization whose demographic is typically 50 and over, this is something that is on our mind all the time. So as the Canadian demographic ages and that cohort of people grows, the needs of that group are going to be critical, and the economic burden of that will be significant in the next 10, 15 years. I think, similar to your first question about collaboration, I really think it's important in the healthcare system to have an integrated approach. So people tend to go to a certain provider for a certain piece of information, which is fine. But I think if those providers are not networking and collaborating with each other, it's going to be very hard to sustain the current healthcare system that we have. I think looking at efficiencies of scale, maybe increasing scope of practice for certain practitioners that are limited at the moment, are ways to help bridge that gap. I think it's going to be a huge challenge moving forward. And then if you look at AI and its impact in healthcare, a lot of people fear AI, but I think there may be many efficiencies to be found once some of the little tweaks that need to be figured out are. But there could be more dynamic, efficient ways of tackling healthcare as we move forward. And in many ways, technology is enabling that. So it will be an exciting time to watch. It will certainly be a challenge, I think, simply because of the demographic and the increased costs and the decreased health human resources that we have. So I really think we need to leverage the technologies and the collaborations that exist and can exist.
Thank you for those insights. So where can people get in touch with you?
So I am always available. I can be contacted through my email, through the organization. So if you go through to the website at www.osteoporosis.ca, you will see a contact us button at the bottom, and you can just direct your question to me, and they come to me daily, and I respond to them daily. So I'm always happy to hear from people and to form any networks that we can and to support each other, because I think that's going to be critical moving forward.
Thank you very much for your time today. We really appreciate you participating in this collaborative series interview, and we look forward to connecting in the future.
Wonderful. Thank you so much for having me.